Go.
Knock knock, Miss Ivy. Hand hygiene. My name is Lauren. I'm going to be your nurse today. I need your name and date of birth, please.
Ivy Armstrong, 4963.
Okay. And do you have any allergies, Ivy?
Just a Benadryl.
Just a Benadryl. Okay, well, I don't think I'm going to give you any Benadryl today. My orders in my computer tell me that I'm supposed to get a nasogastric tube placed with you. Has anyone talked to you about that yet?
I've never even heard of that before.
Never heard of it. Okay, so an NG tube is what we call it all the time. We place it because you have a bowel obstruction, and we're going to make sure that we suction out the contents of your stomach and sort of alleviate that. Do you have any other questions about the procedure before we get going?
Is that gonna hurt a lot?
It is going to be uncomfortable, but nothing should truly hurt you. If something does truly hurt you, what I want you to do is I want you to raise your hand and stop me, okay?
Okay.
And no matter what, I will stop and make sure that we are going to do the right thing. Before I start, I'm also going to pull this curtain so that we have our privacy, since I am going to have to, uncover your abdomen and look at your abdomen. Do you have a history of any facial trauma or surgeries, any reconstructive surgery, anything like that?
No, I've always been healthy.
Okay, well that's wonderful. So right now that means you don't have a sinus infection or like a sore throat or anything?
Not that I know of.
And you don't have any dental work or dentures that we have to take out and set aside?
No, I'm just missing a few teeth.
Oh well, as long as we don't lose any more today, right? Okay, I'm gonna lift you up, lift the bed up so that it's, high enough that I don't have to strain my back. And I am gonna sit you up forward because we need to be sitting up a little more to make sure that this tube goes in the right place. 45 degrees. Okay, is it okay with you if I go ahead and start checking you out?
Sure.
I need to look up your nose, and I need to look in your throat, make sure you have gag reflex. Here's a Kleenex for you to blow your nose. Go ahead and blow through your nose for me. Okay, good. I am going to look up your nose with this pen light real quick. Yeah, okay. And then I also need you to, I'm going to push this side, blow out that other side. Okay, and switch sides. Okay, great. I think I'm going to go on this side because that was the more open side. I do need to look in your mouth. Can you open your mouth for me, please? Open your mouth for me, please. Okay, nothing looks red or swollen, and I don't see anything else back there. And now's the not fun part where I make you gag, okay? Because I need you to have this reflex, otherwise I can't do this. 1, 2, 3. Okay, thank you, and I'm so sorry. This is gonna go in the trash can. I'm done with the pen line. Next, I'm gonna make sure that we still need to do this procedure because I'm hoping that your bowel sounds have returned to normal. But if they haven't, we're gonna go ahead and continue. All right? And then let me know if anything hurts, okay? Yep. Okay, unfortunately, we still have to do this. So, before we do this, because like I said, it can be uncomfortable and you may gag. And if you vomit, I want to keep you clean and dry as I can. So, I will also give you this basin right here, just in case you have to throw up. Okay. There you go. No, specifically. Pause for 2 seconds. Now I'm going to open my NG tube, and I'm going to open this. Make sure this thing is on blue to blue, and I want to measure this tube. Miss Ivy, everybody's nasopharynx is different, so I'm going to measure this, okay? From the tip of your nose to your ear, and then from your ear down to your sternum. Okay, and then give you a couple extra centimeters here. So I'm going to go with just past 45 here, about 48, give or take. And I am going to struggle with my tape just a little bit because it's tape and I'm me. Great. Okay. 1, 2. Actually, this first one we're going to use to mark. Let's mark it so we know that we hit our goal. And then,
Okay, I will be back in checks for about 30 minutes.
all right, there we go. Thank you, tape.
I think I like dropped
Okay.
everything on the floor.
Let's make sure that we have enough lubricant on this to make it easy to go down your nose. All right, are you ready? I need
Yep,
you to tilt
I'm
your head
ready.
back for me. All right.
The tape might be a little bit rough.
Okay.
I don't know if it's necessary. We didn't have it down.
And then I'm going to look and see and check and make sure that that's in there so far.
You're not going to know if the bed was all the way down the
Patient
short
for
as
me.
well.
Go ahead and open your mouth.
I checked them off. Well, I'm just saying you did check the angle. And
Okay.
the tape may be
Yep, I see it. It's in there. Okay, Miss Ivy, tilt your head down for me. I'm going to help you. I'm going to keep going until we get to that. Tape mark for me. Okay. Great. Okay, tape mark has been achieved. I'm going to take this to the side of your face. And then you are going to have to sit real still for me while I find out
throw it in the garbage.
if we have stomach acid. Because if we don't, then we're not going to X-ray yet. Okay, I've got a little bit of gastric juice here. A little bit of gastric juice. And I'm going to put it on this special paper.
I know.
Okay. And then let's see. Yep, that looks like it's between 3 and 4. We're in the right place. Let's call X-ray. I'm going to put the bed down so that when you roll, you'll be safe. Patient goes to X-ray. Patient returns from X-ray. Hi, Ivy. You're back. Okay. This is locked, and we're going back up to waist height because I need to listen to the bowel sounds now that it's been placed in your back. We'll also hook you up to suction real quick. Run around the bed here.
I'm not going to do the third
Because we want to start getting that done. Of course, I left it on the other side. I put it down on the table and left it on the other side. But that's okay, because I can go get it. Extra walking. It's good for me to get my steps in. What's your favorite way to get your steps in, Ivy?
I like to walk to the TV.
I like to walk to the TV. Oh, that's the old way to change the channel, isn't it? All right, so I'm going to turn this on intermittent suction, and I'm going to make sure that it's on low intermittent suction. Okay, now that I've made sure it's on low intermittent suction, it's time for me to listen and make sure I can hear what it is I want to hear.
And my ankles.
I'm going to uncover you, okay?
Sarah checked.
All right.
Or Samantha. You guys both have exits.
That sounds pretty good.
So I have orders for Liz Armstrong for a suction. So that would be weird. For a suction. And low.
Okay. Hey. Better. Much better. You still feeling nauseous?
A little
Pressure
bit.
or fullness?
I feel a lot better.
You feel a lot better. Okay. I've listened. Now I'm gonna push on your belly a little bit, okay? Does that hurt?
No.
No, no pressure or fullness?
No, I feel pretty normal.
Feel pretty normal? How's your pain?
Just where it usually is.
Just where it usually is. Okay. Well, hopefully as that helps suck out some of that stuff, you'll feel better. Do you need anything else while I'm still here?
Could you lower the bed some? I kind of want to lay on my back.
Yeah, the hard part about that is you can't lay flat with an NG tube in. All the contents will come up and you could aspirate. We don't want that. So I will lay you back a bit, but only to 30 degrees and no lower than that, okay?
Okay.
I'll lower you to 30 degrees. So that's about all the further back I can lay you. Here is your call light. If you need help or need anything, push that light. I'm going to document what we did.
Great, looks good.
Okay.
Latex, okay.
Anything else before I go, ma'am?
What I'm in here today.
Could you hand me my call light?
Like I said, your call light is right here in your left
We're here
hand.
to place an NG.
Thank you so much. Call me if you need anything. Hand hygiene and exit.
You tell me